So I'll be talking about consent as a source of bias. It's very early on in this particular project, so I won't be giving many numbers, but just to explain the context. My fellowship, as I mentioned, is funded by Health and Care Research Wales, and I'm looking at linking survey and administrative data to enhance understanding of risky behaviours, potential protective factors in children receiving care and support. And this is a feasibility study. So the project aims to explore the benefits of linking survey data to routine administrative data to give a more accurate picture of the prevalence and patterns of participation in a range of risky behaviours amongst children receiving care and support relative to their peers, the role played by moderating factors, and also to explore a little bit more about how much can be gained from actually linking the two sources of information. So the risky behaviours that I'll be looking at are smoking, drinking, drug use, bullying, and that includes use of sexually offensive terminology and hate speak, and also cyberbullying. I'll also be looking at exclusions, truanting, sexting, sexual health, and that includes underage sex, not using contraception and emergency contraception, getting into fights, gambling, and adolescent relationship violence. This range of behaviours is determined by the questions that are asked within the survey. Protective factors include things like having a support network of peers, perhaps family or at school, kind of resilience and linked to mental health, different demographic characteristics, and also those relating to the neighbourhood. And I'll be looking at the interaction between those. Some of the specific tasks I intend to do are to look at the reliability of self-reported measures, particularly around exclusion and truanting, and also the measure that's been used previously, I'm going to say in the real world, to identify the children who are looked after in terms of being in foster care, residential or kinship care. The intention, because this is a 5-year study, is to look at those who look at risky behaviours over time, and also understand that role played by moderating factors. In terms of my specific research questions, a key area that I'm at the moment is actually looking at the limitations of this approach. So just to say a little bit about the School Health Research Network data that I'll be using, it's very much a policy practice research partnership, which is between the Welsh Government, Public Health Wales and Cardiff University, and it was established in 2013. It's an incredibly rich data set, and as you can see, it's used to improve young people's health and well-being in Wales. It's conducted every 2 years, and every 4th year there's an international element. There's both student and school level surveys, and they capture key health and well-being metrics. And these have been used to inform a whole raft of national policies and strategies. The data that's been provisioned in SAIL is the student level data. So we're missing the information about the school environment. So for ease, rather than referring to the Student Health and Wellbeing Survey, I'm just going to refer to it as SHRN data. So in terms of who's actually invited to participate in the survey, it is a network of schools that have agreed to participate. And you can see here that it's mainstream secondary and middle schools. Those in special schools, pupil referral units and other settings are not currently invited. And to be included in the Welsh return, you need to be educated in Wales, as this is conducted through schools. So there's 210 schools in the network, of which 198 completed the survey in 2019, equivalent to 94%. And those schools with sixth formers are involved in the survey, not all invite their year 12s and year 13s to participate. The number of year 7 to 11 pupils who completed the survey is equivalent to 119,388, which is about 72% of all pupils in mainstream secondary or middle schools. There were 136 schools that consented to data linkage, and we can look if we look at the data that's been provisioned in SAIL, that the year 7 to 11 pupils account for 30,830 pupils, and this is equivalent to about 26% of the students. In terms of the information and how this can actually be used, pupils were actually asked to give consent for their responses to be linked to other data sets in SAIL Databank, and they need to be able to provide adequate identifying and information for an ALF to be generated. So pupils are asked to give consent and then to give their first name, last name, date of birth, postcode, and then gender is actually taken from the survey response. So out of that 30,830 year 7 to 11 pupils, there's actually 27,760 who gave consent to data linkage and sufficient information for an ALF to be created. And that's equivalent to about 87% of those who completed this, who gave consent, and around 22% of those who completed the survey from that age group. In terms of how children receiving care and support are identified, the conventional approach, as I said, in the kind of real world, this is based on a proxy measure, which uses the responses about who the pupil lives with. Within the SAIL environment, I'm actually able to compare the responses to the official records. So I can compare the responses to the looked after children and the CRCS. And these are the two data sets that Lucy's just described. But I need an ALF to be able to link to these. So this is a little bit complicated, but I'm just going to go through the different data linkages, because this also helps to explain when I'm looking at the profiles and trying to understand consent, whether it's a source of bias, it gives you a sense of who I can look at and what kinds of information I can get, and where there are limits. So Lucy's described the linkage between the looked after children and the children receiving care and support. These are on slightly different timescales, and you have episodic data from the looked after children, which means that we can actually find out the pupil status on the day that they made the return. With the CRCS, it will include many of those who are who are looked after, but there could be subtle differences. As Lucy mentioned, the CRCS doesn't give coverage for the whole year. Status can change. And also one of the things that we find is that to be eligible for the CRCS, then you need to have had an open case for 3 months before the 31st of March, which means that we can also make that inference that they had that status on the 1st of January right through to the 31st of March. However, the fieldwork was all conducted during the autumn term, and things do change. So as you can see, there's not a complete overlap between the two, but the episodic looked after children data can be used to determine the legal status and placement on a given date, whereas the CRCS snapshot allows you to determine their status, whether they were looked after on the Child Protection Register or other. It's possible to then compare this to the education data, and we have a single pupil ALF table, but then we can find out more of those who are in more mainstream settings and special schools, educated other than at school, and also 16 plus. The education data set is a snapshot that's taken in mid-January. The educated other than schools is typically mid-February, although that is changing. And the 16 plus information actually gives us a snapshot from very early in the autumn term about whether or not they were pursuing particular learning aims. So we can see now that you can get this sense of where there's some challenges in identifying status. So I mentioned previously that those attending special schools, pupil referral units, other educational settings other than at school, and potentially those that are in not the appropriate age group, who are not in the national curriculum year group equivalent for their age. So if they were held back a year and were still in a primary school. So we can divide the education data set to determine eligibility. As you would expect, there are some children receiving care and support and looked after who fall into each category, and this is something that I'm actually looking to explore. And of course, there are some children who are placed outside of Wales and are therefore educated elsewhere who would not actually appear in the Welsh education data. So I'm able to split the data set and look at those who are ineligible to participate compared to those that can participate. In terms of the SHRN data itself, as As I mentioned, 198 out of 210 schools in the network participated in 2019, but there are a larger number of schools in Wales. When we factor in the consent, we need to work out just what proportion of those that were eligible to participate also consented. And this gives us with a series of different groups. Apologies for the way I've tried to represent this. But you can see that there's a proportion of those where we have information about their looked after status, their children receiving care and support status, the education setting is that they're in a secondary school, and they gave consent for data linkage. We also have this missing group. So this is a group who are theoretically eligible to participate by virtue of their setting and their age, but potentially their school didn't participate, or their school did participate but didn't give consent to data linkage, or they themselves did not participate. They themselves participated but didn't give consent, or simply that they didn't participate at all. In terms of the linkage, the key is in the bottom right-hand corner, but you can see that we're very much limited as to what we can do with the SHRN data, where they gave consent but didn't give adequate information to generate an ELF. And you can see here that I've been able to divide this into 4 groups. So in terms of the data that I have when I'm doing my comparisons of year 7 to 11s, you can see the 4 groupings there. So group 1 is, I can see their social services and education data, so I can pull out basic demographic data, their CRCS status, potentially their legal status, placement and information. If they're educated in Wales, I can find out a bit more about their setting, if they have additional learning needs, free school meal, and language spoken, and also about the language of delivery within the school, whether it's a Welsh medium school. And get a similar amount of information for those that are eligible but missing. For those that were eligible but consented and had no consent, I haven't got that information about the CRCS or the looked after status. I'm just able to rely on their SHRN data. So I can see things like their age based on their year group and their gender, and I have a full set of information from SHRN. And one of the things that I know, the very fact that they're there and reported in Sale, is that they must have been in a mainstream secondary school in Wales at the time. The most useful group that I'm particularly excited about starting to play with is group 4. So these were eligible, consented, and had an ELF. And this gives me the ability to link not just to the social services, education and SHRN data, but also to later data sets. And that's something that's going to be particularly relevant when I start to drill down. So in terms of the next steps, once I've actually sorted out the data linkage, I plan to do profiles of each of the 4 groups to see if there are key characteristics, particularly around children receiving care and support, to see if they're under or overrepresented in Sale Databank. I plan to repeat that with the 2021 responses. The field work for the 2023 survey is currently ongoing. But my first question is whether or not consent is a source of bias when linking survey and administrative data to enhance understanding of risk behaviours and potential protective factors in children receiving care and support. I intend to do more work to look at how a further question that's being asked within the SHRN data about children who have lived away from their parents for different periods of time and who they live with can be used to help us to kind of more easily identify this particular cohort and help to develop some recommendations to feed back to those who are using the SHRN data outside of Sale. And I'll be feeding back to some of the experiences that I've had to the SHRN advisory group in March. In terms of future plans, and this is where I'm particularly excited about group 4, I plan to drill down and undertake cross-sectional analysis in respect to each of the risky behaviours and look at that for each of the waves. Using the different data sets, I can then look at the risky behaviours and enhance what we already know. So the education data set, for example, can actually give us more information if they said that they truanted or had been excluded or they'd engaged in bullying in the last 12 months. I can then go back and look at the official data about what was actually said. Similarly, I can do this for substance misuse and also some of the health data sets to find out what is known about pupils' engagement in these different behaviours. And this can give us a more nuanced kind of understanding of the interaction between these and with protective factors. I'm already going, because this is a 5-year project, I'm going to be able to track individual responses over time to see if there's different trajectories for different behaviours. So a year 7 in 2019 would then be a year 9 and then a year 11. And I can look at their behaviour both in the years that they've participated in the survey and the intervening years. And this longitudinal analysis, I hope, will actually reveal some really interesting information about whether or not there are these different trajectories in terms of onset and desistance for different groups, not just looking at the headline group and treating it as if it's being homogenous, but drilling down to find out more about whether the differences by gender, by age, and by status. And this can help to then inform having more timely and appropriate messages delivered either through school or other mechanisms. At each stage, I'm linking in with Cascade Voices and also Decipher's young people's group, which is called Alpha, to check my interpretation, language used, and also for their views on implications. So if you'd like any further information, my details are on the screen, and I've repeated the QR code that Lucy shared earlier. Thank you very much.